You're watching 13 on your side.
We begin tonight with the new guidance from the CDC on how to protect yourself from COVID-19. The updated recommendations relax some of the guidelines, including changes to social distancing and quarantining procedures. 13 on your side's Andrea Flores is here with details.
Juliet, healthcare experts in our community are predicting a surge of COVID-19 cases this fall and winter. They're hopeful that the level of severe illness and death remains low as West Michigan adopts these new guidelines.
COVID is still complicating a lot of people's lives. It's just not at the rates as it was 2 years ago.
Kent and Muskegon counties currently sit at a medium level transmission rate for COVID-19.
But you're not seeing the same hospital peaks in terms of hospitalizations, ICU admissions, ventilator management, and death.
And that's why the CDC is coming out with new guidance.
Some people get nervous when recommendations change, but that's what you want to happen. That's what should happen. Recommendations should change when the situation changes.
Those who are unvaccinated no longer need to quarantine if exposed to someone with COVID-19 and are not infected. Like someone who is vaccinated, they need to wear a mask for 10 days and test on day 5.
But they can continue going to work, going shopping, things like that. But just be careful of other people. If you know someone is high risk, maybe don't go around them right at that time.
The CDC says testing requirements to screen for COVID-19 can go in schools and some workplaces. And a staple preventative measure since the start of the pandemic is changing.
In the beginning, it was absolutely key. We had very few tools in our toolbox.
Social distancing is now recommended to be done as needed, based on individual health risk and transmission level in the community. Marcia Mansaray with the Ottawa County Department of Public Health says adding treatments and vaccinations was key to getting to this point in the pandemic.
Right now, they're not saying don't socially distance or don't quarantine or don't wear a mask. What they're saying is use the tools that you have and add them in as needed based on your risk or the risk in your community.
The new guidance also limits contact tracing to hospitals and certain high-risk group living situations. And if your symptoms come back after your isolation period ends, regardless of vaccination status, it's recommended to restart your isolation period. Juliet?